To start with, we'll update you on the number of new cases that we've had in BC since our last report on Saturday. So that is for two periods, between May 2nd and May 3rd, and then May 3rd to today. So our first period from Saturday to Sunday, we had 34 new cases diagnosed here in British Columbia, bringing the total that day to 2,205. And then over the last 24 hours, we've had an additional 19 people test positive for COVID-19 here in BC. So that's 53 new cases since Saturday, bringing our total to 2,224. Of those, 845 people are in Vancouver Coastal Health, 1,027 are in Fraser Health Region, 124 people were in Vancouver Island Health, 177 in Interior Health, and 51 people in the Northern Health Region. We currently have 23 active outbreaks in long-term care, assisted living, and a couple of acute care units. There are no new outbreaks in those areas. Actually, there's no new outbreaks to report today. We have had additional cases, 13 cases in long-term care assisted living or the acute facilities that have been affected, bringing our total in those areas to 266 residents and 168 staff. In our community outbreaks, I will update you on where we are with those. As you're aware, we have 3 outbreaks that have been declared in poultry processing. We now have 7 positive cases in the Fraser Valley specialty poultry, 54 people who've tested positive from Superior Poultry, and 35 from United Poultry. And I apologize, I had the numbers incorrect on Saturday. In addition, we're up to 134 people associated with the Mission Federal Correctional Facility, including 121 inmates and 13 staff who've been affected. We also, as I mentioned on Saturday, have continued to have people associated with the Curl Lake plant in Alberta. We have 15 people who directly from that plant who have tested positive in BC, and we also have additional family members. And this is one of the reasons we have been so concerned, and we have asked anybody who's returning from working at the Curl Lake plant while the outbreak continues there, and we do know that it is continued, and if they have no more cases, it'll be near the end of May that the outbreak will be declared over. And I know they've put in a great deal of the important outbreak response measures in the facility there in Curl Lake, and that is really important to help protect everybody who is on site there. But when people are coming back from an outbreak, we do here in BC require people to self-isolate whilst they're here. And that is because we know that people who have been in an outbreak situation are at higher risk of developing this illness during the incubation period. And so until the outbreak is over in Curl Lake, we do have that requirement for people who have returned here. And we also ask their family members to be careful and to monitor themselves for symptoms. We have had occasion where a family member of somebody who's worked in Curl Lake has come back and not recognized that they've had a mild illness, have passed it on to a close contact, and that close contact was a healthcare worker. So we need to be very vigilant right now that we're monitoring ourselves and being very careful where we know that there's risk of transmission of this illness. Currently, we have 77 people here in BC who are in hospital, and of those, 20 are currently in critical care. Unfortunately, we've had another 3 deaths related to COVID-19, all of them in long-term care here in the province, bringing the total number of people who've died to 117. And as always, we are thinking every day of the families and the care providers for these and the communities of these people. We now have 1,417 people who have fully recovered.